Okay, it is almost 1:05. Why don't we get started? Stacy, if you want to share the slides, and we can get into welcomes and interpretation instructions.
Entonces ya vamos a empezar con las pantallas y también las instrucciones para acceder a la función de interpretación.
Great, thank you. So this is one of our longer Vax Power Hours. We will be here until 3 o'clock talking about storytelling and giving you some updates and providing some context around back to school.
Entonces estamos aquí por una reunión un poco más larga de 2 horas. Estamos aquí hasta las 3 compartiendo historias y también compartiendo información relativo a tiempo de volver a la escuela.
Great, and I'll pass it over to Stephanie, who can take us through interpretation instructions, which many of you are likely familiar with already, but we'll go through one more time.
Hello, everyone. Hola, buenas tardes a todos. Haga un clic a interpretación y seleccione su idioma preferido, inglés o español. Si tienes cuestiones, por favor, coloque en el chat.
And I'm muted. So make sure to choose which channel you'd like to tune into so that you can hear either myself or Emily do the translations. Thank you, everyone. So if you want to go to the next slide, Stacy. Great. So as usual, please rename yourself. So we would like you to rename yourself your name, your preferred language that you want to use, and your pronouns as well. So you can click on participants in your Zoom toolbar, or click on the 3 dots or more next to your name, click rename, and then rename yourselves that way. So as the example again, you can rename yourself English and then or Spanish or bilingual, and then your name afterwards. Great. So today we'll be going over our welcome and our icebreaker, giving you some updates on Delta, on the vaccine, give you some context around back to school protocols, and then get into our training on storytelling. So we'll be going over how to find your story, how to best tell your story, and do some activities in breakout rooms. And then we'll get into closing and next steps. But first, we did want to introduce 2 new team members, one of which you already got a chance to hear from. Christina Figueroa will be a TA lead for a couple of groups. She joined our team maybe 2 or 3 weeks ago. And we also have Stephanie Guevara, who will be our coordinator. So she will be transitioning in the role that Jasper was previously in. So for any concerns or questions you may have, you can email Stephanie instead of Jasper. And we're very excited to have them both on our team. So as usual, we'd love for you to introduce yourselves in the chat. So your name, your pronouns, your organization. And today's icebreaker question is, what is your favorite story? And this can be a story in a book format, a movie, a TV show, an oral story, any story that's your favorite, put it in the chat. And I'll narrate some as they come through. So again, your name and your favorite story. Awesome. Thank you so much. I'm seeing a couple of great stories come in already. Tortoise and the Hare. I love the throwback. Flossie and the Fox. Percy Jackson. Mary Poppins. This is great. I'm loving all of these nostalgic stories coming in. Les Mis, Things Fall Apart. Oh, this is all great. The White Lotus Show, Ghost. If you're anything like me, you will probably be copy and pasting this chat later to add it to your watch list, your movie list, your book list. Oh, we have some folk tales coming in. Outlander, Boy Who Cried Wolf. This is great. So I'm excited throughout this training as we think about the elements of storytelling and as we think about crafting your own story, hold on to why you love your favorite story, and we can think more about the elements of good storytelling and how we can translate some of those into the stories that we tell about our work. So as usual, thank you for bringing your name into this space and more of what you like. Keep them coming in, but we'll be getting started. But before we get started, Stacey can go back. We just wanted to recognize that this week has been hard for a lot of our community and hard for us as a collective. There's the humanitarian crisis in Haiti, what's happening in Afghanistan, and we just wanted to acknowledge that because these touch all of our lives, also the communities that we work in, and we just acknowledge that our work continues in this context and it can be really hard and heavy. So we just wanted to recognize this and take a moment of silence for the lives that were lost this past week in both of these crises. Thank you. And again, if you all need any support for talking about any of this in your communities, please reach out to your TA leads and let us know how we can support you individually in your communities, whatever you all need. But with that, I think I'll be passing it over to Tamaki for some updates.
Thank you, Kelly. With all the things happening in our personal life and the work life, I just want to take a moment to thank you all for your commitment and your continuous hard work and all the great strategies and the hard work that we can see in this data now as of August 10th. And this is, I think the last time we had this Fact Power Hour and then shared the data was 2 weeks ago. And then within the 2 weeks, you can see this whole increase percent. Just gonna read through really quickly. Is now in Massachusetts, 70% of people have received at least one dose of the vaccine, which is 1% increase. And even if 1% is so many people in Massachusetts. And for 12 to 15 years old, we have now 63% have received at least one dose, which is 4% increase. And now is the total of people who fully vaccinated is almost 4.5 million. I want you to digest what that means and how much work is going on behind us in the behind the scene. And when you look at the race and ethnicity group, as you can see, so many groups have increased. And even if there's no increase in that, like a couple of the groups, is a lot still increase, so that it's just not appearing as the green. But again, I just want to acknowledge that a lot of work has been happening behind the scene that you all are part of. Right, next slide, please. All right, we have a lot of updates and information that we want to share today, and particularly for a few things that have been in a lot of folks' mind is the Delta variants. And this is the resharing, same information that we shared as last time, but this is a refresher. This is from Massachusetts, a few characteristics for the Delta variants. The Delta is more transmissible than the original virus. And it has more virus in people's respiratory tract. And the people who were infected carry the virus longer than the original virus. And during the July 4th and 17th, 83% of cases are coming from the Delta variant, according to CDC. And in particularly in the New England area where we are, 68% of cases are from the Delta variant. And most importantly, the message that you want to share with the folks is the single best way for people to protect themselves, their loved one, and in their community from COVID-19, including the Delta variants, is getting vaccinated. So it's the same message that you all have been sharing with the folks. And all the 3 vaccines available in the United States are effective against the COVID variants, including Delta. Next slide, please. All right. And so mask guidance from CDC. And then again, this is the same information that we share with the update map that we have for Massachusetts. So CDC recommends that people wear a mask in public indoor setting in the area of substantial or high transmission. As you can see in the map, almost all Massachusetts are either orange or yellow. I mean, the red or orange is high or substantial area. And fully vaccinated people may choose to wear a mask regardless of the transmission level, especially if they or someone in their household is immunocompromised or at increased risk for severe disease, or if someone in your household is unvaccinated. And in terms of the guidance for unvaccinated people, it's still the same. Prevention measures are recommended for those people. And particularly for Massachusetts, the state is not mandating a mask. It's up to local communities, cities and towns, businesses or organizations. Next slide, please. Right, back. And the mask guidance for Massachusetts particularly, even though the state is not mandating, there are certain locations where wearing the mask is required. If you're on public and private transportation, if you are at the healthcare facilities, congregate care facilities, emergency shelter programs, house of correction, healthcare and day services, or if you are in healthcare setting. And there's a note that this healthcare setting, the home-based healthcare settings only applies to the workers providing care. Next slide, please. All right. So we have been receiving the news about the booster almost every single day. And here's the latest summary that we put together as of this morning, because we did receive the latest news this morning. So the booster has been approved by FDA and CDC for immunocompromised people. So they do recommend immunocompromised people to receive an additional dose of either Moderna or Pfizer after the initial 2 doses. And then for wider public, the booster will be available on September 20th. And then again, this is only for Moderna and Pfizer. And in terms of Johnson & Johnson, we're still waiting for the results of the clinical trial, which will be available later this month. And that will determine the timing of the Johnson & Johnson booster. So this is a lot of information that I just share all at once. And I just want to take a kind of pause to see how you all feeling about this. Do you need more information? Do you have questions? Anything that you need to digest? Just want to take a pause and then see if folks have any questions or any comments. We see any hands? Any folks have any questions? Yeah, I see the question from Suzanne. Are there lots of comments that are offer countries should get the vaccine before we give boosters? Yeah, there's a lot of comments and in the article about that. It's the sort of global equity issues. Yeah, we are talking about that a little bit on our team as well earlier. Any other question? There's another question here. Would the higher risk people be notified for the booster shots when they're available? So what we hear so far is that the booster rollout will be somewhat similar to what we've seen in the earlier in the year, how the initial vaccine became available. But I'm sure more information and detail will come a little bit later. Any other question?
Mejor lo hago, lo pregunto así.
Yes, please.
Que me cuesta la pregunta es que, por ejemplo, la persona que ya recibió las 2 vacunas de Pfizer, ¿cuánto tiempo para que pueda tomar como la tercera o la Moderna también? No sé si me expliqué. Muchas gracias.
So is there a time, minimum amount of time between the first 2 and the third? Esa es la pregunta.
What
¿sí o no?
I saw on the CDC website or other sources, I'm gonna double check, but what I heard is about 4 weeks. But we can follow up with that. Oh,
It's 8 months.
I see 8 months.
We will elevate this to DPH to get clear because I've seen both.
I think also the question about notification, I interpreted that question as meaning, will your doctor call you up and tell you, hey, you're eligible for the booster shot? Not, is it going to be like on the news? And I think that sort of depends on your relationship with your healthcare practitioner and if that was the person who gave you. I mean, I got my vaccine at a pharmacy. I'm not expecting the pharmacy is going to call me up and tell me, hey, you can get the booster shot.
Right.
I assume it's up to me to know, oh, now I'm eligible. Here's, April 10th. Okay, 8 months from April 10th, that's when I'm eligible.
Yeah. Thank you for lifting the other question, Lisa. But just before we move away from that, just to make sure people are clear, the question from Sebastiana was how long after your last full injection, so 2 if you receive Pfizer, Moderna. We've heard both 8 months in a couple weeks, so we will clarify that with the Department of Public Health and follow up with you all. But and then Lisa, you brought up the question in the chat, which yes, you all could assume that it is now on the honor system. As of now, there's no, as we know, people are not being reached out to necessarily, but we can also confirm that with the Department of Public Health to ensure that that's the messaging. Sorry, Maki, I know
Yeah.
there's, someone who had their hand up, Milagro, I think, had her hand up too. Yeah. Milagro, did you have a question?
Yeah, one of my question is, there are some people who are coming from Latin America and other countries, and they have AstraZeneca as vaccine. What will be the booster required for those individuals?
I'm muted. We don't have the answer for that now. There it has been advice shared within public health, but we'll follow up with you all about that. There is guidance, but we don't want to share misinformation.
Yeah, because we have a couple of people that we wanted to make sure that they get the follow-up vaccine because they have some conditions. And one of the recommendations also for the immunocompromised, people who has rheumatoid arthritis, people who has diabetes uncontrolled, and people who has been on treatment for chemotherapy or other immunocompromised conditions, HIV/AIDS. So among those, the majority of them.
Thank you.
Thank you. There's another question. Would you need to return to where you were vaccinated, or you can get the booster anywhere? I know this is related to what you're mentioning, Daisy, earlier. This kind of details, we don't have answer right now. And that's the discussion and the conversation. I'm sure it's happening at the state level as well. And as we receive more information and details, we'll share that with you all.
I knew I saw a Milagro with the hand up. There's another Milagro. Go for it.
Yes. Just a quick question with hearing the news on the military personnel that they're going to be forced to put the vaccine. Now, my experience here has been because I had several volunteers that were vets. They went ahead and they put the vaccine on, just the regular vaccine, as far as the first dose, the second dose. When they went in for the second dose, the glands started, puffing up. I mean, underneath the arms and the back, it was really gross. So my question is this, giving you that information, my question is this, because SARS and whatever we are putting on right now, they're so similar. What is the guidance for military personnel that has already received vaccines in the past that are extremely similar, may I say, to what we are receiving today? Some of these folks are being affected because they do have other effects, secondary effects, if they let's say overdose themselves with the vaccine, and they're doing it because they're following procedures. What guidance do we have, especially if we have folks that are volunteering and that we are working with? I mean, the numbers are not huge, but it's still a life that we need to inform. What is there for us to share with these individuals?
And just to clarify, Milagro, you mean, just to make sure I got your question right, you're talking about military personnel who've had reactions to vaccine that they have received the first dose, second dose, both? Just to clarify.
Actually, they got a third because they had the SARS first. When our previous wars that we've had, they were supposed to or mandated that they get vaccinated, so they got. So in this particular case that I have, which are two actually, they went and the Veterans Affairs Office sent them over to take the vaccine, and really their glands, I mean, really they look like if they were on steroids, their arms, and it was really, I mean, I saw that case. So with this third dosage that is being recommended, is this also going to be for that personnel that has taken something similar to, or if they have already taken one dosage? I mean, are they forced to take the third dosage? I'm just a little bit not confused. I'm concerned about because some of them, I don't think that would need, only because they're healthy individuals, they're just doing protocol. Are they, you know, are they mandated to take this third dosage? That's my whole.
No, good question. No one is mandated, number one, and number two, anything about medical reactions need to be referred to that person's medical professional. We should, if we're not medical professionals, if we're not providing medical treatment, no one except their doctor can provide them guidance. So anything that comes to you about some kind of physical reaction, or this is what happened when I got the first vaccine or the second, always refer them to their medical professional. So
we did that we did, but I was just concerned that this keeps, if this will be keeping, keep reoccurring with some folks that had already taken some dosage of the
No, it's right to be concerned, absolutely, but not mandated. It's actually being encouraged.
Okay, thank you.
Booster that are immunocompromised. So that certainly should be something people should talk to with their doctor. But yeah, luckily it is not mandated.
Thank you.
Question. Thank you. A lot going on. A lot of questions, right?
Yeah.
Yeah.
I see the comment from Gordon. Could it become like a flu shot where we get it every year? Potentially, but we have to see how it goes because this thing's changing every day. And Timon is asking about the Novavax today. We talking about the Novavax today? We are not. In fact, I haven't heard about the Novavax. This is really good to know. We might want to look it up. But if there's a need, we might consider talking about it in the future. But we have to look it up first.
Thank you. These are great. Keep rolling them in. I'll be contacting DPH immediately after this so we can get answers to you all right away. So don't hesitate to share more in the chat, share more with your TA lead, and with each other today, even as it comes up when you all talk. Awesome.
Yep. I took a lot of notes of things that we still need to explore and then follow up. So please share if there's any particular question about the Novavax. Yes, thank you, Karen. Right. If nothing else, if you have any additional question, please feel free to put it in the chat or reach out to your TA as usual. Right, we're gonna move on to back to school update. Believe it or not, all of the students are going back to school pretty soon. Stacy, if you could advance the slide.
I'm sorry, my computer just froze, so I think I'm going to turn this over. Technology. Sorry, folks, my computer is frozen. It just closed. Let's see what's going on. Restart.
Yeah, I can keep talking while you're dealing with the technical difficulty, Stacy.
Okay.
All right, so I'm gonna share a little bit of update about the full 2021 school guidance that we have from the state. In Massachusetts, all school districts will be required to be in person. And there are two items of the guidance that we are sharing. Physical distancing requirements are lifted, although the schools are encouraged where possible, but it's not required. And schools are encouraged to maintain ventilation updates, hand hygiene practices, and the policies of staying home if you're sick. So that's the state. And there are some districts in Massachusetts that are requiring indoor mask for all students, or students and then staff, regardless of the vaccine status. And then there are long list of school districts in Massachusetts so having that requirement, right? And for DPH, the Department of Public Health and the Department of Elementary and Secondary Education strongly recommend this sort of mask guidance for the following students and staff. If they are wearing mask indoors, if they are in kindergarten through 6th grade, if they are unvaccinated students in grade 6 and above, unvaccinated staff, those at higher risk, regardless of their vaccine status. And the following students and adults remain unmasked if they are vaccinated, if they're students, well indoors. All students, well outdoors. If they're vaccinated educators, well outdoors, although in alignment with state masking advisory. So this is about the wearing the mask, especially in the difference between like indoors and outdoors. And then again, this is the state, and you can refer to the each school your school district for the requirement as well. Right, moving along. So now a lot of folks are looking for COVID-19 testing sites. On mass.gov, you can search the testing sites near you by searching with the zip code, miles within. You can also do the advanced search like free testing, weekends, and drive-through from the website that you see right there. And other questions that we hear is, what do you do if you lost your vaccination record card? The first thing that they would advise is to contact the vaccination site where you got the vaccination from. Now, I acknowledge that there are different kinds of vaccination sites that folks go to. It could be the private clinic, could be pop-up clinic, so different kinds. You would contact, if it's clinic and healthcare providers, it's pretty straightforward. But if it's something pop up, they might need to go through the organization that organized the clinic, and they can link you to the provider. And you may be also able to print your electronic health record directly from the provider's website. Or if you're enrolled in the CDC programs called the vSafe, you can also access your record. Next slide, please. And we also wanted to remind you all that the DPH is still accepting the request for mobile vaccination services in your area. It's a pop-up clinic, or the pop-up the vac site. But again, this is not for the vax bus that was available, and the buses has been ended. Next slide, please. All right, so this is the latest resource that are available. I know many of you already know about the flyers and the posters for the no ID or health insurance needed. Now we have a wallet cards available, and it's the printed copies so that you can hand it off to the folks in the community. And then that's available in the 13 languages that you can see now. In addition to the additional languages that some of your grantees requested, and which will come a little bit later on. And then again, free copies are available at the clearinghouse at the website address that you see there. All right, now I'm gonna hand it off to Kelly for the storytelling.
Thank you. I want to just pause for another 2 minutes just in case any more questions came up, because I know that was a very hefty update section. and we can capture these questions and elevate those to DPH. Okay. Well, if there are no questions, I can keep going, but please, as questions come up, do not hesitate to add them in the chat box. But we would love to get started talking about storytelling. So this is one of our longer Vax Power Hours. We're doing that training, and we really just wanted to take some time to figure out how to ground the work that we're doing in storytelling, just so we can help promote our work and put a face and a name to it through telling stories. Next slide, Stacy. But first, we were really excited to elevate one work that a grantee group is doing, the Jewish Family Services of Metro West. They're taking storytelling in a really interesting direction. There is an author that lives in their community that wrote this children's book called Lily the Llama. And they're working with this person to translate the story into a couple of different languages to then share with their community and also do live readings of it at events, religious events, community events. So Stacy wants to, she can flip through quickly and I can just ground kind of what this children's book aims to do. It features this llama called Lily the Llama, and she is at her annual physical, afraid to get her vaccine because she doesn't know what it will do. She's afraid of shots, and her pediatrician talks to her about how vaccines help protect her and her family against illnesses. So COVID isn't mentioned in this story, but it just elevates about the importance of vaccines in a way that's really simplified and can land with children, but also puts a story and a narrative to it. And we can drop this link later in the follow-up email so you all can explore it too. But we thought it was a really cool and innovative way. No problem, Stacy. We thought it was a very cool and innovative way to take storytelling into a different direction to encourage people to get the vaccine who might be afraid of it. So not just COVID, because we know young kids are not cleared yet to get the COVID vaccine, but once they are, I think this really sets a good foundation for them to be ready to do that. So why are stories important? I think, you know, many of us have been telling stories our whole lives, but also through our entire lifetimes and our bloodlines. I think oral history is older or is just as old as human history itself. Many of us come from a culture and a background of oral storytelling. So we know that this is what connects people. We know this is how history can get passed and how people can really get encouraged and excited to make some behavior changes, but also to just assign meaning to things. So storytelling is important because stories really help create that context and provide meaning to what's happening around us. I think back to a lot of mythology and folktale about, you know, years and years ago when things were happening in the world that didn't make sense, people used storytelling to add meaning to it and make sense of the world around them. It helps us relate and also empathize with stories and other people. And there are many different types of stories that you can choose to tell. They can be your own personal story, they can illustrate a challenge or a strategy, and they can also be a call to action. And so what we're going to focus on for the first bit of this training is really that personal story. So you have a main character, it's people-centered, there's action, and we're going to talk more about how you can kind of take the personal story or take your work and turn it into a personal story. And a great example of this is from another grantee group. So Hannah Tello of Greater Lowell Health Alliance wrote this story and was able to get this published in a major news outlet. And as we were reading this, we just thought, like, this is a great example of how simple storytelling can be and how it can just paint this really vivid picture and encourage people to get the vaccine. So I'll take a minute to just read this out loud And then you'll be able to get a chance to talk more about the feelings this brought up and the implications it might have in some small groups. And so in this article, she was quoted, "Throughout the day, I watched as vaccinators stayed busy and took note of who hopped in line. A mother was able to get her vaccine thanks to the many youth volunteers available to entertain her 4 young children while she sat in the observation area. A couple who were concerned they didn't have the right documents to qualify were escorted by an interpreter who helped explain every step of the process. An elderly woman with her 2 adult children with special needs was able to bring them all together at the same time, which had been challenging for her to schedule via the online system. The flow never ebbed." So as I'm reading through that, I hope it painted the same picture that was created in my mind when we first read this. There's the main character, there's the witness, there's also all of the characters in the story, the elderly woman, the couple, the mother, the children, all of them were presented with a challenge. They needed to get the vaccine, but there were all these factors in the way that blocked them. But throughout this great storytelling, we were able to exemplify kind of how they overcame those challenges and got vaccinated. So there's the rising action, there's the success, they overcame the challenge at the end, all while focusing on the story to get vaccinated. We can go to the next slide, Stacy. So this is an example too of how stories can create context. So it can be hard to get the vaccine and there are people to help you along the way. And this is kind of the context that this story can help create. It can ground us in a strategy on how we can help overcome those challenges. And again, provide context as to what's happening and can illustrate your successes and the benefits and the challenges that you might be facing at your organization. I think stories are a great way just to really paint that picture, which can stay with us. Data only does so much. Data is great, but when you attach data to stories, again, it paints that vivid picture that's more memorable, and you can help recall it better later, because as humans, we really process information a lot better through storytelling. You can go to the next slide, Stacy. But stories are also really helpful because they can move people to act. They engage people, they provoke emotion, and emotions impact decision making. I think we see this a lot when it comes to policy making and encouraging policy change. I think a lot about the work that we do outside of this grant around youth tobacco prevention, where every year we take high schoolers to the State House, where they tell policymakers about the presence of e-cigarettes or the presence of tobacco in their communities, and they tell their personal stories. They're not necessarily saying you need to ban cigarettes, you need to do X, Y, and Z, but they're painting a picture of what their communities look like and how present tobacco is in their communities. And it's been a really effective way to just engage policymakers, especially with youth voice, to help kind of get the ball rolling on priorities in the legislature. So it's a great example of how we can leverage storytelling to move people to act and take a different action. They can help bridge different people. They connect folks by highlighting the things that we share and can relate to, and it just builds empathy. I think if a story can strike a chord in our hearts, we can all relate to that shared experience, and it's memorable. So we're not just telling a story to highlight our organization, we're also telling stories to connect with our community members and potential partners too. Data alone can be dry. I love data, but alone it can feel like we are trying to memorize different stats and figures. I could tell you that 1/3, this is not a real data figure, by the way, 1/3 of Bostonians are vaccinated. And then you might say because of challenges. But if you start to tease out the challenges and tell that story about a person who is trying to get vaccinated or trying to get a COVID test and their experience on how that went for them and why they didn't end up getting it because of those challenges, that helps land their experience better and helps shed light on why these numbers are the way they are. Stories tell 1,000 words. And good storytelling, as we said, can encourage people to act. It can encourage them to get vaccinated, to volunteer with your organization, to donate to an organization, come to an event, pass a policy, anything. But stories really help provide that empathy that spur people to action. So we want to give you maybe about, I think we actually have time for 25 minutes, 20 minutes with a 3-minute warning to come back in small groups to talk more about Hannah's story. So we can share her story in the chat, and we can also share these questions as well. And as we put you into small groups of 6, we want you just to think more about what connection did you make to Hannah's story? How does Hannah's story move people to act? And what implications do you think this could have for the work that we're doing to get folks vaccinated? Thank you, Jasper, for putting those questions in the chat. And again, as you kind of reflect on this story, reflect on the stories that you put in the chat for your icebreaker. What makes a good story? Even if it's fiction in what you wrote, all of the elements of good storytelling are very similar. How is good storytelling portrayed in the story that Greater Lowell Health Alliance put forth? So we'll put you in groups for 25 minutes to talk more about that. And then we'll bring you back for how you can start to think about your own storytelling. If you have any problems in your rooms, please let us know. And we will see you shortly.
So the story is around, getting vaccinated for your elders, for your children, to protect your family. So that was one piece of messaging people talked about. And also that the community-oriented messages are much stronger than individual-oriented messages for the same reason, right? And even in Hannah's story in a community of Lowell, which is also my community, we don't know the race or ethnicity in the story, but I'm going to make an assumption that it's likely BIPOC people or refugee immigrant people. And so that community care for children and for families makes such an impact and encourages people to be more open and receptive to vaccination sites and the people who provide vaccination, the vaccinators, as mentioned there, have a big impact in how they treat people, language, cultural competence, all of those things make such a difference. So we had a fantastic group and it was a great conversation.
Good. I'm so glad. And I loved everything you touch upon, just those shared values and, that ability to really just connect and hold space for that community care. Thank you. Anybody else want to share back about what resonated with you?
There's some wonderful ideas about incentives, like bringing the Vax bus at a pizzeria and getting free pizza and ice cream, or at a barber shop and getting like a voucher for free haircut. I think those are really nice incentives.
I love that. Thank you, Sonia. And I think that's a very nice segue into how you can find that story. And a lot of storytelling can come from promoting an event and providing that incentive. So thank you for making that connection. I think we can move on, Stacy. So I'm glad that you all got a chance to talk about what resonated with you all from Hannah's story, because a lot of what I imagine you all talked about and what Isa and Sonia shared is really how the story was framed and how you all connected with it. And, you connected with it because of how the story was laid out. There were the characters introduced, there was a challenge, there were other supporting characters, and they overcame a challenge and ended with success. And so it had a very clear beginning, middle, and end. People showed up at the clinic, they were worried about different challenges, people helped them overcome different barriers, and they got vaccinated and probably felt really connected and supported by their community. So there was a main character in there, all of the people who were getting vaccinated and the folks who were helping. They faced challenges, and in the end, the main characters or the community is changed in some way, or there's a call to action. So again, these are just very simple ways to tell a story, and this is just one way to tell a story. It is a formulaic beginning, middle, end, and character driven. We're going to talk a little bit more about other ways you can tell your story, but we think to build off of Hannah's example, these are the elements of how to tell your story in one way. So Stacy, if you want to move forward. So good storytelling. I think, can you go back one slide? You might have skipped one. Oh no, never mind. Sorry about that. So another element of a good story is that it has a compelling character. And people care about people. So giving your character a face, a name, and a voice is something that can be really helpful. And this, again, can be more meaningful than just these blanket statements of, it's really hard to get a vaccine, and that's why potentially vaccine rates might be low in your community. You know, we understand that broad statement, but it might not have a major impact if you don't feel very connected to it. But when you give that face to that person, like that mother with her two children who had special needs, who needed that extra help and care so that she can have her children be watched safely while she can feel empowered to get her vaccine, you get to understand a bit more about the nuances of the challenges people face, understand more about the community values, and figure out kind of, okay, that's the context for why it might be hard to get a vaccine. So, you know, we're empathetic by nature. And so it really helps us land the context better when things are told in the story format. The next element is that a good story can offer a solution. So you can provide a solution to the conflict you identify in your story. Someone wants to get a vaccine. They have two children that need to be watched, and the vaccine clinics might not have childcare. There's the conflict. You can empower people to be a part of the solution. So as you're telling the story of this mobile clinic that also had childcare, other people may read that and may have had a clinic that didn't offer childcare, and they might feel compelled and really called to action by empathy for this mother who had a really hard time finding a vaccine appointment with childcare. They might want to create an event that has a vaccine clinic with childcare. And so again, this can be that example, or it can be as simple as just talk to your grandma about getting the vaccine. And you use language that can create a sense of urgency. Why is it important to get a vaccine right now? Why should people care? You can, again, say the numbers about how COVID cases are rising. That's why it's imperative everyone gets a vaccine. And you can, again, have that data and then add context by putting a human face and a name to it and provide that solution of, it's hard to get a vaccine. Here are different solutions that you can do to help ease that barrier. We started driving people to the vaccine clinic. We provided childcare. We did whatever it took to get folks vaccinated to feel empowered and supported to do so. So we use stories for a couple of different reasons. I think, Hannah's story accomplished a couple of different things. It highlighted the good work that's happening in Lowell. It highlighted the community of Lowell and the community care that folks have for each other there. And it also probably sparked some ideas for other people running similar community events on how they can run events so that it is accessible to many different people. But that's one example. You can also encourage people to come to an event or a meeting. instead of just having a flyer about when your next meeting is, maybe there's a blog post or a news story about what happened at your last meeting, or about what's on the agenda. You're talking about a mobile clinic. Why is that important? Who are the big players? Why should people come to this event? How can you spin that into some sort of story to get people to come to your event? You can use stories to change behavior, get vaccinated, get tested. Can be as simple as that. But I think a really fantastic thing that stories can be used for is to promote your organization and the great work that you're doing, which is why we have that picture that says, do not be afraid to toot your own horn. You all are doing fantastic work that everyone should know about, and you all should be really proud of that. And so you can do this to get recognition, either from your local government. I think a lot of what we're doing when we talk to you all in our TA sessions is to get those stories so that we can tell that to DPH, so they can really see the great work that you're doing and see that tangible impact with that human face. It can also help you secure funding too. I think, grant writing, there is a role for storytelling in writing a grant to create that compelling narrative as to why you should be funded. It can be great in donation appeals, such as fundraising letters. And also stories can help paint a better picture of the work that you're doing as you're creating partnerships. So if you're looking, for example, to partner with teachers or partner with parents or local health clinics, how can you describe how you do your work in a story? How can you describe what your mission is by talking about, I had this great meeting with a young person where we gave them back to school supplies, and this is all about the work that we're doing. So stories can really just help not only share your successes, but really help promote your organization in important spaces. We want you all to get a chance to practice telling a story. So we'll send you into breakout groups one more time, and you can talk through these guiding questions. So as you think about what stories you might want to tell, these questions might be a good place to start. So do you have an event that you want to tell your community about before it happens, which would be getting that call to action? Come to our event, tell your friends and family about it. Or did the event take place last weekend? That was great. You talked to a ton of different people. You had this amazing back to school event that it went so well that you want to share it with the world and write that press release, talk to it to partners about. That could be something that you could write about too. Is there a story about someone who got vaccinated after you talked to them? And it might not have been a one-time conversation. Maybe your story was, you went to church every weekend and there was one person who each weekend you talked to them a bit more about the vaccine. They started off being really resistant and then kind of ambivalent. And then after talking to them for a month and having these multiple conversations, maybe they got vaccinated and they told you about that. Is there someone who was able to get vaccinated because you were able to help them? And that might be you provided transportation, you provided childcare, you provided interpretation services, any of those. Do you also just have an amazing volunteer who's going above and beyond? Is it a young person? Do you have a new partnership that you want to tell people about or highlight? I think these are all important starting points that have stories within them. So I want you to go into breakout rooms one more time. We'll do the same groups of 6, and we'll give you 20 minutes this time. Actually, it's 2:30. We can do close in 5 minutes. We'll give you 25 minutes so you can get a chance to practice, and I will put these questions in the chat box, and then we can send you off into groups. So again, you're not necessarily telling a story, you're just practicing it how you might tell a story and what content you have in your work that has a story within it. So we'll send you into breakout groups, get you back here at 2:55, and then close out. So Stephanie can work her magic on the back end and send you off into groups whenever you're ready, Stephanie.
Okay, I sent everyone to their breakout rooms.
Awesome, and if people want us to pop in, press up, ask for help, and they're gone. So fast.
That was very fast.
That was the fastest. But you could also share that via the broadcast, Stephanie. If folks want one of us to pop in and support, they could let us know. Although we could also pop in on our own.
Got it. I'll send one out right now.
I'm
Cool.
popping into room 4 just to go listen.
Cool. Thank you, Stacy. I will be right back. I'm not going into a room, but I gotta step away for a second.
Sounds like maybe 25 minutes wasn't enough for these conversations, but there will be plenty of opportunities to continue these conversations, both in Vax Power Hours and also with your TA leads too. If this planted a seed that inspired you, bring a draft of your story to your TA lead and we can help you workshop that. So Stacey,
Thank you.
want to go back to the slides? We can quickly wrap up. We have a quick poll that we want you all to take, along with just some additional tools that you might want to use. And Nairobi just shared an event that they're hosting, so definitely check that out.
Can you see my screen?
Yes, we can. Thank you, Stacy. So I think sadly we don't have time to share out any particular stories, but I really hope that you felt inspired by other grantees that you spoke to and inspired by the examples that we elevated, and that you have, again, that seed planted for what story you might want to tell. And now that you have your story, maybe the beginnings of it, we want to talk more about where you can actually tell your story and what form they might take. So once you have your story, you start to think about what is the best format or the way to go about telling it. It might be a blog post. It might be a press release to send to different media outlets. It might be a series of social media posts. You might host a podcast episode. I know a few of you have been guests on podcasts, also have been guests on local radio shows. You might do a YouTube video, a PSA, which is a public service announcement. And where you want to tell your story is dependent on your goal and also your capacity too. If you don't have audio equipment, if you don't have podcast equipment, that might not be where you want to tell your story. You might not have Twitter. You might not have Instagram. You might be really comfortable at doing blogs, but these are all different ways to tell your story. And this is where we want to ask you all, where do you want more skills in this? So we talked a lot about what questions you can ask yourselves and where stories might be hiding in the work that you're doing. But we also want to figure out what support do you need to tell your story? So we're going to launch a first poll in English and a second poll in Spanish, just to ask, what do you want more support on? Do you want a training on, or a Vax Power Hour on how to write a press release? Do you want a Vax Power Hour on how to create partnerships with local media? Do you want a Vax Power Hour on like, okay, I have a story, now I want to take this content and make it into an Instagram campaign or into a Twitter campaign? How do you translate content across multiple platforms? So I think maybe I have the power to launch this poll, but so a poll should be launched right now on your screen that says in English, but the Spanish version will be coming once we close this poll and relaunch it. And you can pick multiple options, but we just really want to know what topics related to storytelling would you like another Vax Power Hour on? And we can share the results. And please definitely let us know. It might be an optional drop-in session that's outside of Vax Power Hour. It might be a Vax Power Hour. We want to get a sense of really what you all want and what you all need. Thanks so much, everyone. We're already at 66% of people voting. I'm loving all of these events coming through in the chat box, so please tweet them out. If it's in your community, definitely attend, tell other residents about it. Okay, I'm going to end the polling and then relaunch it in Spanish. It looks like right now how to translate your story across media has been a really popular one. Noted. And for folks who would like this in Spanish, that is now launched. And while that's happening, Stacy, I know we're at time. If you just want to go to the next slide, just so we can do a quick wrap up with reminders and next Vax Power Hour sessions. As always, please fill out your weekly reporting form due today. And please also come to our next Vax Power Hours. Our next one is August 25th, and that is on faith-based organizations and leveraging relationships with them. We also have one on September 1st, September 15th, and September 22nd. And this next training model will be on September 15th. Okay, and it looks like we have all of our answers to the Spanish poll, so I'm going to end that. The HRE folks can stick around for a little bit, but I really just want to thank you all for your active participation. I know we saw a bunch of you nodding and smiling throughout, so thank you for being present. Thank you for talking so much in breakout rooms. We really appreciate all the work that you're doing. And please let us know if we can do anything else to support you getting your stories out there. Thank you, everyone.
Thank you.
Take care, everyone. Until next
Thank
time.
you. Have a good